Hello everyone. Hello everyone, and thank you for having me today. I'm Enass Shamsy, a dentist and a lecturer in dentistry and dental hygiene. The idea of this presentation came after my experience in teaching in the dental hygiene field. Working in the dental hygiene lecturing significantly broadened my perspective as a dentist and deepened my appreciation for the role and expertise of dental hygienists and therapists. As a clinician, I was already aware of the importance of preventive care, but it wasn't until I began teaching dental hygiene students that I truly understood the depth of knowledge, skill, and critical thinking involved in their scope of practice. So today our presentation will be about bridging the gap and how enhancing collaboration between dentists and dental hygienists and therapists will achieve optimal patient outcomes. So why collaboration matters? The evolving landscape of dentistry emphasizes a team-based approach, and this is something which is already established in many practices. And as we know, improved collaboration leads to enhanced patient care, efficiency, and satisfaction. And this is the goal we all want as dental health practitioners to achieve by the end of the day. All our efforts and work evolve around achieving the best patients' outcomes. So the objective of this presentation is to highlight the importance of effective collaboration and to explore what existing barriers we still have in terms of this collaboration and propose some solutions to enhance this collaboration. So first of all, I just want to revise something most of you we already know it, which is understanding roles and scope of practice. So basically, dentists are responsible for diagnosing, treating, and managing oral diseases, and dentists perform complex restorative and surgical procedures. On the other hand, the dental therapists and hygienists are more related to preventive and periodontal care, including scaling, polishing, fluoride applications. And dental therapists will perform some simple restorations and share with the hygienists oral health education and smoking cessation. So, through lecturing, I gained first-hand insight into how dental hygienists are trained, not just in scaling and polishing, but in periodontal assessment, patient education, behavioral change strategies, smoking cessation, and risk factor identification. I witnessed their strong foundation in prevention-based care and how integral their forces is in managing chronic conditions such as periodontitis and maintaining the long-term oral health. So when our roles overlap and complement each other, how these roles work together for holistic patient care. Engaging with my students, dental hygiene students, and developing curriculum also helped me to reflect on areas where dentists and hygienists and therapists can collaborate more effectively. I began to recognize that true patient-centered care requires us to work as equal partners and strengthen each other's strength. This academic experience inspired me to advocate for more integrated teamwork in clinical settings, where the contributions of hygienists and therapists are acknowledged, not just as supportive, but as essential to achieve optimal outcomes. So just start by exploring some challenges in collaborations that we still have in the practice. So in terms of role ambiguity and misconceptions, we still have some lack of clarity on the scope of practice. Many dentists are even patients are unaware of the full scope of dental hygienists and therapists are trained to do, which leads to underutilizations of their skills. Also, we have communication gaps. Without regular team meetings or structured referral pathways, important clinical details can be missed, resulting in fragmented patient care. So, insufficient interdisciplinary discussions and unclear referrals still exist. Also, the workplace structure and hierarchy. In some practices, traditional hierarchies discourage therapists and hygienists from contributing to treatment planning, even when their input could enhance outcomes. And lastly, we still have regulatory and training differences. Because scopes of practice and training programs vary widely between regions, what a therapist is allowed or expected to do in one country might be very different in another, causing confusion and inconsistency. So, looking at these current challenges, all of these challenges were well explored in the literature. So, in a paper published in the Journal of Dental Hygiene in 2024, Team Working in Dentistry, the authors have found that regulatory and systemic barriers often limit the dental hygienists from working to their full potential, even in countries where direct access, which means that it allows patients to see a dental hygienist without a dentist referral, is permitted. And some dentists remain hesitant about expanding dental hygienist roles due to concerns about training, supervision, and patient safety. Also, the paper has concluded that workforce shortages in dentistry highlight the need for better utilization of dental hygienists to meet increasing patient demands, and policies supporting the integration of dental hygienists into healthcare teams could improve efficiency and enhance patient care. Also, in another paper, which was published in 2017, exploring the barriers and facilitator in the integration of oral health into primary care, the discipline-oriented education and lack of competencies was some of the main barriers that was explored in this paper, as a scoping review highlighted that traditional discipline-specific training often leads to a lack of interprofessional education, resulting in healthcare providers feeling unprepared for collaborative practice. Also, this educational gap contributes to insufficient knowledge, attitudes, and skills necessary for integrated care. There is also lack of continuity of care and services. The same review noted that understructured mechanisms for care coordination, poor referral systems, and fragmented practice types hinder effective collaboration. Also, solo practices and those with specific client lists were found to have lower referral rates to dentists compared to more integrated clinics. In another study, which was published in British Dental Journal in 2009, this study was about the dental therapists' underutilization. While dental therapists consider themselves part of the clinical team, many feel their skills are not fully utilized. They reported that dentists often lack awareness of the therapist's clinical potential, leading to under-referral and limited scope of practice. So, looking to all of these barriers, which were already established in the literature, we'll try to look for best practices for effective collaboration. Again, some studies have explored these solutions, and in general, we have three main themes that we as dentists and hygienists and therapists should work on. First of all, we have the clear communication strategies. Using shared patient records and structured case discussions ensure everyone is on the same page regarding diagnosis, treatment planning, and follow-up. Also, regular team meetings and case reviews create space for open dialogue, clarify uncertainties, and foster a more cohesive approach to care. The second theme is defined roles and responsibility. It is vital having clear referred protocols helps avoid duplications of effort and ensures that each team member is working at the top of their license. And standardized guidelines support consistency in decision making and help build trust in each other's clinical contribution. In interdisciplinary training and continuous professional development, it is also very important to have joint workshops and case-based learning sessions, which allow dentists, therapists, and hygienists to learn with, from, and about each other. By promoting also mutual respect and shared learning, we create a team culture where collaboration is the norm and not the exception. So again, these solutions were explored and established in the literature. We have this paper, which was published in the Journal of Dental Hygiene in 2024. It was published in 2022. A qualitative study conducted in the Netherlands examined the collaboration between general dental practitioners and dental hygienists. The study found that factors such as leadership style and shared goals significantly influenced the effectiveness of collaboration within oral care practices. Again, supportive leadership and patient-centered goals were associated with more effective teamwork, potentially leading to improved patient outcomes. This paper was published in 2024, explored dental hygienists' perceptions of collaboration with dentists and their intra-professional educational experiences. The findings indicated that dental hygienists generally had positive perceptions of collaboration with dentists. The study suggested that enhancing intraprofessional education could further improve collaboration, thereby benefiting patient care. Again, another study, which was published in 2019, explored the integration of dental therapists and general dental practices in Wales. Through a structured literature review and 6 case studies, the research identified factors influencing the successful adoption of dental therapists within dental teams. The findings suggest that effective integration of dental therapists can enhance preventive focused care and improve teamwork within dental practice. The dental therapist role in shared care approach to optimize clinical outcomes was published 2021. It presents clinical cases demonstrating the full scope of practice of dental therapists. It highlights how a shared care approach between dental therapists and dentists can optimize clinical outcomes for patients, emphasizing the importance of collaborative practice in dentistry. So, in summary, what are the future directions and recommendations? So first of all, we have to look to policy changes and institutional support by advocating for integrated dental care models. Also, we can enhance technology and digital solutions, implementing such technology and digital solutions such as teledentistry and shared patient management systems can enhance this collaboration between dental hygienists, therapists, and dentists. Lastly, strengthening educational curricula. It is highly important to give more emphasis on interdisciplinary teamwork in dental education. So after graduation, each individual in the dental team knows their own role and scope of practice, because the importance of delegating the dentist delegating tasks to dental therapists and hygienists significantly improves the dentist work by allowing them to focus more on complex procedures that require specific expertise. So the full integration of dental hygienists and therapists into dental teams can lead to more effective care, improved patient outcomes, and better access to dental services. Also, addressing barriers through education, regulatory changes, and fostering mutual respect among dental professionals will strengthen teamwork and enhance the overall efficiency of dental practices, which is our ultimate goal. Thank you for listening to my presentation, and if you have any questions, please don't hesitate to contact me, and have a nice day.